Good day to everyone, and welcome to the October Online Scientific Meeting. I am Dr. Preselyn Leonora from the Committee on Scientific Meetings of the Philippine Pediatric Society. Let us sing together the PPS hymn.
Pediatricians, we are gathered here and afar, called to offer our lives for a cause. For our children, we strive to sustain health and life. Dedicated, we rise to this cause. The body respond. In our vision we launch all the children of the land. We vow to serve and far beyond. For God's tender, loving hand we proudly stand. With our body respond, with our vision we bond. All the children of the land, we vow to serve and far beyond. For God's tender, loving hand, we proudly stand.
To welcome everyone for today's activity, let us welcome the hardworking President of the Philippine Pediatric Society, Dr. Jocelyn Eusebio.
Welcome, my dear colleagues. As we are seeing now, the trend of mental health conditions among children and youth are increasing at an alarming pace in the last decade. With the advent of the pandemic and prolonged lockdown, these mental health issues have even become more concerning. No one is spared. The most vulnerable of them are the children and adolescents. The impact is great, and studies have shown that these mental health issues can still persist for years after the pandemic. We therefore have to safeguard the socio-emotional wellness of this vulnerable population. Our particular situation is unique as everyone is affected, adults and youth alike. We are pleased to have the experts from the Philippine Society for Child and Adolescent Psychiatry to tackle this problem, represented here by its president, Dr. Rodora Andrea M. Concepcion, and our speaker, Dr. Vanessa Kathleen Kainghug, and Dr. Daryl Joyce Lindo Calleja as moderator. They will enlighten us further on how to safeguard the mental health of our youth. On behalf of the Philippine Pediatric Society, I would like to thank the Philippine Society for Child and Adolescent Psychiatry for their willingness to share their expertise today. May we all learn the effective strategies to mitigate the impact of the pandemic on this population. Thank you and good day.
Thank you very much, Dr. Eusebio. Today, we are fortunate to have the Philippine Society for Child and Adolescent Psychiatry to give us an overview of today's topic. To introduce our experts for this session, let us hear from the moderator, the Public Relations Officer of the Philippine Society for Child and Adolescent Psychiatry, Dr. Mary Daryl Joyce Calleja.
Good day, everyone. Before I introduce our esteemed speaker for today, I'd like to call on the President of the Philippine Society for Child and Adolescent Psychiatry, Dr. Rodora Andrea Concepcion, for some words of acknowledgement.
Good day to everyone. I'm Dr. Rodora Andrea Concepcion, President of the Philippine Society for Child and Adolescent Psychiatry. On behalf of the board and officers of the Philippine Society for Child and Adolescent Psychiatry, we would like to thank the Philippine Pediatric Society, headed by its president, Dr. Jocelyn Eusebio, Vice President Dr. Flor T., Dr. Christine Gutierrez, Head of the Committee on Scientific Meetings, and Dr. Prix Leonora as coordinator for this online session, for this partnership to participate in your online scientific session on mental health of children and adolescents during the pandemic. Truly, there are a lot of challenges among children and families during this time of pandemic. And through the Vice President of the Philippine Society for Child and Adolescent Psychiatry, Dr. Vanessa Kathleen Kainhug, who will be our speaker, and PSCAP Board Public Relations Officer, Dr. Mary Daryl Joyce Lindo Calleja, as our moderator, the Philippine Society for Child and Adolescent Psychiatry would like to present to you a discussion on mental health of children and adolescents during COVID-19. I hope that we could all learn together in this scientific meeting. Thank you very much once again to the Philippine Pediatric Society, to our colleagues and audience for joining us.
Our esteemed speaker for today is a practicing child and adolescent psychiatrist. She is the current chairman of the Department of Psychiatry at St. Luke's Global Medical Center. She's also the training officer of the Child and Adolescent Psychiatry Fellowship Program at the Medical City. She is the immediate past president of the Philippine Psychiatric Association and our current vice president in the Philippine Society for Child and Adolescent Psychiatry. She has been a widely requested lecturer and has played an active role in the Task Force for Mental Health, which is a partnership of the Philippine Pediatric Society and the Philippine Society for Child and Adolescent Psychiatry. Ladies and gentlemen, our speaker for today is Dr. Vanessa Kathleen Kainghong.
Thank you for that introduction. Let me just share my screen. I will be talking about the mental health of children and adolescents during our current situation, the COVID-19 pandemic. Let us not forget that prior to this scenario, the mental health of children and adolescents had already been at the forefront of the problems being dealt with by mental health professionals for the past 2 or 3 years. And then this pandemic came in. So let me talk about this topic. Before I zero in on children and adolescents, let me talk about mental health first. And the World Health Organization wrote a very good definition of mental health. It says that mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her own community. Now, when we talk about mental health, we should always remember that various factors contribute to a person's overall mental health. The most important factors are grouped into three: biological, psychological, and social. Included in the biological factors are the person's physical health, any disability, drug or medicine effects, temperament, IQ. The psychological factors include still the IQ, the temperament, family relationships, and any previous trauma. For the social factors, included are relationships with peers, family, school, and the environment. All these factors come together and contribute to a person's overall mental health. Okay. Now, we all know about the coronavirus. This has been a major threat to our health and a danger to the global economy starting at the end of 2019, and it became a very big problem all over the world starting January or February of 2020. It affected global economy, it changed people's lives and influenced our daily routines. It caused increased episodes of panic, anxiety, depression, and intense dread. So this has posed as an unprecedented challenge in most people in our lifetime. Okay. Now, the effects of COVID-19 caused changes in the psychological and social factors which contribute to mental health. These changes causes stress in an individual, and when the individual is having increased stress, this individual will be at risk for mental health problems, especially in children and adolescents. So these are just some of the headlines since the COVID-19 came. Uh, a lot of mental health experts have been hurrying to come up with a vaccine. Almost everybody have been adjusting to this new normal. Uh, People have been adjusting to lockdown rules, and of course, COVID-19 is also changing the world's children. Okay, this pandemic has three phases. For phase one, it is called the preparation phase. This was the time when the rates were steeply increasing. This was around February, March, April. And there is the punctum maximum phase, which is phase two. And the phase three is the return to normality phase. Right now, in the US and the Europe, they are experiencing a second resurgence. So parang they are having another phase one because the winter is coming and their incidence rates are again steeply rising. So we are still far from the phase three, the return to normality phase. I am hoping that this will come next year when the vaccines arrive. Okay. Now, for phase one and two, what are the mental health risks for children and adolescents? There are community related risk factors for mental health. These are disruption or limited access to basic services. The schools closed in most countries. There, especially at the start, there was lack of access to basic mental health services. But I know that here in the Philippines, almost all or most mental health professionals shifted to online consults. So now, right now, we are all available online. There were limited operations of child welfare services, etc. Also, our leisure time was greatly affected. We could not go out to have dinner in malls. We couldn't watch movies. We couldn't go out to meet our friends, etc. In short, we were all isolated in our homes. So, sudden changes in our lives brought by the COVID-19 pandemic are as follows. Our family lives were reorganized. Parents suddenly shifted to work from home. But for parents who were already working from home prior to COVID-19, it was not a big change. But this was a minority in 2019, the parents who worked from home. Right now, it is the norm. Also, in the Philippines, we are used to having the help of our grandparents, right? Grandparents and various relatives would help in caring for the children. But with the coming of COVID-19, senior citizens had to be isolated because they were very vulnerable. That's why help from these people was immediately or was quickly cut off. Okay, and there's restricted contact with grandparents. So the family's connections and support was disrupted. Okay, and especially at the start, there was an intense fear of losing a family member, especially if that family member is a frontliner or a healthcare worker. There was intense fear of getting COVID-19 and losing that family member. And also, our bereavement process was changed a lot. We are all used to having uh, wakes, internment, etc. But especially at the start, whenever a person died, the body had to be immediately cremated and no wake was allowed. Okay, and also it falls on the responsibility of educating children about COVID-19 fell on the parents. Okay, and most importantly, the COVID-19 pandemic caused economic recession in most countries. There has been increased financial pressure, unemployment, income decline, and manageable debts. These problems are factors which can increase the rates of mental disorders, substance related disorders, and suicidal behavior in adults. And when the adults are stressed, this will also translate in stress in the children. Okay. Now, what are the challenges within families? 85.7% of parents who participated in a study published in April 2020 reported changes in their children's emotional state when the quarantine came. The primary caregiver's perception of how easy, whether it is easy or not for the family to live together related to 11 of the 31 child symptoms. So if the family has difficulty relating to each other, especially over a prolonged period, this will relate or equate to more symptoms of mental health problems in children. So the more the family difficulties in coexistence equates to a higher level of stress, and parents tended to report more emotional and behavioral problems in their children. And during phase 1 and 2 of the pandemic, in a study published in China, 54% of the participants of a large online study rated the impact of the outbreak on their mental health as moderate to severe. And this is very remarkable. Depressive symptoms and anxiety were the most common problems reported. Another thing which you have to remember, domestic violence and child abuse or maltreatment will also increase because adults and children are staying at home 24/7, and there is less chances for a victim of child abuse to have reprieve or escape from the perpetrator. So the incidence of child abuse will increase. Also, income loss and economic hardship can lead to stress and marital conflict. The quarantine can lead to decreased freedom and privacy and higher stress rates. So, increased exposure to perpetrators and reduced chances for the victim to temporarily escape will cause more stress. And the potential long-term effects in mental health of children from exposure to domestic violence is also grave. Okay. Now, when quarantine was imposed in various countries, the measures imposed also gave associated risks for mental health. There is detrimental effect of disease containment measures on the mental health of children. Occurrence of post-traumatic stress symptoms, depression, low mood, irritability, etc. among those in quarantine, those who had to really isolate themselves because they were exposed to COVID or became COVID positive, had even higher stress levels. There is also increased risk of online sexual exploitation because remember, most people are at home, and what do? They are on their gadgets. Okay, so sexual exploitation online is on the rise. There is a possibility of direct effect of COVID-19 infection, and this can lead to aggravation of mental disorders. Okay. So the emerging evidence from current studies is that there is a generalized feeling of stress and anxiety symptoms as self-reported in children and young people across the world. I will later cite several studies about this. Grief is also complex right now because there is a disruption in our typical grieving process. I have already discussed this earlier. Okay. Uh, of note is the social distancing measure which was imposed with the quarantine measures. So there is now reduced social networks within the student community. It is the norm among students to have pleasant interactions with their peers, to bond with their friends, and they get their emotional support from their classmates and friends. But when the quarantine came, this was abruptly cut. So you can only socialize online. And study groups cannot be done anymore. But I hear that some kids still do study groups, but it is online. They just study together on Zoom, etc. Okay. So the social isolation in teens caused increased mental health problems. And again, these are anxiety, depression, non-suicidal self-injury, suicidal thoughts, irritability, and eating disorders. Eating disorders, I can just say my personal experience. This is not very commonly seen in our clinics. Example, no, for the past 2 years prior to the COVID-19 pandemic, I would get about 2 to 3 patients in 2 years. But since February, I already have 5 to 6 new patients of eating disorders. So I was really, it was really remarkable for me. Okay. The social isolation that teens are experiencing right now can be compared to uh, other infectious disease experiences in the past, like the SARS, the avian flu, the H1N1. During those times, 20.9% in a study also experienced social isolation. One third of parents in the study also reported that their children needed mental health service. And the most common diagnoses were acute stress disorder, adjustment disorder, which are some forms of anxiety disorders, grief, and post-traumatic stress disorder. Okay. Now, during this present pandemic, it is remarkable that children are reporting that their ability to cope is decreasing or on the decline. This was a study in Australia, and it showed similar reports among females, males in different parts of the country. All subjects said that their ability to cope was declining. So, what did young people report that changed for them? Okay, another study, still from Australia, showed that young people reported that they had to stop seeing their friends. Their education was disrupted or stopped. Their extracurricular activities were stopped. Their parents or carers lost all or part of their income. So that is income decline. Okay. A lesser intensity is in employment and risk exposure to virus, and access to important psychological support services were disrupted. Okay, but this reports of young people in Australia, I think, is universal. Okay, and another report from the same study showed that the pandemic and national response has impacted on young people's day-to-day life and social connectedness. It showed about 70% reduction in social connectedness, 60% had negative impacts on the general day-to-day life, and about 50% had increasing levels of anxiety, about 30% had reduction in levels of hope. Okay, so what are young people worrying about? Number one is about their education and future, almost 70%. Isolation from friends and schoolmates, again, almost 60%. The health and safety of friends and family, almost 60%. Contracting the virus, more than 50%. Okay. Uh, about the information on COVID-19, young people are keeping themselves abreast with new information, but effective communication is critical. Uh, Most agree that watching or reading the news about relevant announcement is important, and so have good understanding. Discussing developments with family and carers who help them understand also showed about 60% agreement. Okay. Now, let us look at this chart. Uh, it used the patient health questionnaire rating scale. The patient health questionnaire rating scale is a good rating scale to assess uh, the mood or emotional problems of young people. And in this chart, this study was in China. It showed that almost 60% had little interest or pleasure in doing things. And they reported almost about 40% of the symptoms in the patient health questionnaire. And this is alarming because this shows that a lot of young people are having a decline in their moods. Okay, that was depression, the patient health questionnaire. Now let's look at the rating scale for anxiety or generalized anxiety disorder. It reported the same. Around 40 to 60% reported symptoms about anxiety. Okay, now let's talk about school closure, which is the top worry of young people. About worldwide, about 1.27 billion children are estimated to be currently out of school or having online school. School closures impacted over 72% of the world's student population, and disruption to the lives of students and their families who are now tasked with homeschooling as well as child care caused a lot of stress. Okay. Now, in the Philippines, about it's about 28 million learners who shifted to online school, and you can only imagine the stress that this brought about. And the stress, I think, is more for younger children, like grade school and preschool, because it is much more difficult for these kids to shift to online learning. Okay. uh, Let us look at the impact of disrupted education on mental health. There is missed academic and extracurricular milestones, difficulty transitioning to distance learning, reduced motivation towards studies, increased pressure to learn, abandonment of daily routines, and potentially higher rates of dropouts. Among my patients, I was thinking at the start of the pandemic that young people will be happy because there will be no school. This was relatively true for a number of youngsters. However, as the pandemic dragged on and the no school extended to several months, then the stress and depression and anxiety came. They started to worry about their future, their schools, their missed activities. Okay. Uh, with online schooling, there is also difficulty in predicting the precise nature and duration of the impact on school closures because we are still in the middle of the pandemic. There is also extensive periods of home confinement, thus reduced outdoor activity and access to physical space. This will impact on kids who are athletic and who like outdoor activities. Another study in China still showed 25% experiencing symptoms of anxiety among college undergraduates. And this positively correlated with increased concerns about academic delays, economic effects, and impacts on daily life. But protective factors are the following: living in urban areas, living with parents, having a steady family income is important. And I know that many households are suffering from uncertain financial status. Okay. With the closure of schools and universities, there is potential loss of contact with friends, concerns about home learning, loss of structure that school represents, and the loss of formal or informal pastoral support, and a loss of their safe place away from difficult home situations. As I have mentioned earlier, if the child is experiencing trauma or abuse at home, they will have less escape to a safe place. Okay, now for phase 3, we are not yet there because this is the slowly returning to normal phase. It is reported that mental health symptoms will outlast the acute phase of the pandemic. So it is predicted that even after the pandemic is over, the mental health problems will continue. So this is the long way back to normality. So for phase 3, we all have to deal with the economic recession, and this will still cause the mental health problems in adolescents and children. The rate and direction of change in macroeconomic conditions rather than actual conditions affect harsh parenting. So, resources in the healthcare systems may not be enough to overcome the previous lack of treatment and supervision. Okay, now let us talk about adolescents who had mental health problems even prior to COVID-19. These children are at higher risk for exacerbations of their original mental health problems. These children are those who are exposed to maltreatment and domestic violence. Uh, the sequelae of the pandemic associated increase of maltreatment may last for a lifetime. Okay? Other high-risk children are those with chronic disorders, for example, those with autism, with intellectual disability, because they have reduced or canceled therapies and support systems. And there is again increased risk for maltreatment. Okay. Those kids who had existing mental health problems can have more severe outcomes, and their health can suffer due to a delay in prompt diagnosis and treatment because the mental health professionals had to shift online. And taking care of children with mental health problems can be more challenging to already distressed parents. Imagine a parent who has a normal kid has already problems with online learning. Can we think about the parent of children with ASD, ADHD, or autism, and they have to supervise the learning? That is a bigger problem. Okay. Now, 83% of young respondents agreed that the pandemic worsened their pre-existing mental health conditions. So school closures, loss of routine, restricted social connections, these all contributed to worsening health conditions. And while young people overwhelmingly accepted the response, the impact of the crisis is not lessened. Of course, there is still again increased anxiety, sleep problems, and panic attacks. And there is also an increasing rate of NSSI, or non-suicidal self-injury. Also, notable is the increase in OCD symptoms. But I think that being OCD has positive effects because we are all careful about our hygiene, but this can be bothersome if it is severe. The loss of routine in children, uh, because routines are good coping mechanisms. But when this is removed from you, i- a coping mechanism is gone. So the stress is more. Okay, young people, including those with eating disorders, anxiety, food shortages, and potential restrictions on exercise, will experience higher stress. Okay. The loss of connection. Most children are concerned about losing connections with friends, non immediate family, and trusted adults. And especially so among those who did not feel confident or comfortable using phones. But I think more kids are comfortable using phones, or those children who had limited access to technology. This was uh, more of a problem for them. And I think that the divide between the haves and not haves is greater here, because children who do not have access to gadgets will suffer more. Okay. uh, I have been talking about the negative effects of the pandemic, but let's not forget that this situation also had benefits for some children, or if not just some, but for many. It gave us time to rest and relax for the family and to have less hurried life, di ba? Our back-to-back meetings were gone, our traffic was lessened, and we had more time to stay at home because we had no choice. There was a stronger sense of community and cohesion among family members, and increased social support will help strengthen resilience. Okay. Some children troubled by school bullying might find homeschooling as relieving, and children who have problems interacting with their peers reported that they liked the online learning. And successful management of stress and trauma uh, included is the personal characteristic of the child will translate to personal growth and development, and equate to a sense of competence or resilience in the child. Okay. A small number of young people also reported that their mental health had improved during the crisis. This was related to difficulties with relationships in schools. For example, being bullied, or uh, not wanting to attend face-to-face school, feeling positive about the response. For example, friends who are proactively contacting them and reminding them that they are valued, and finding that their own anxiety has a clear focus and is now shared by other people. So these youngsters reported that, on the contrary, their mental health improved. Okay, now I have been talking about anxiety and depression, but what are the red flags? Or how can one say that your kid or your child has anxiety? Some red flags are the following. For toddlers, the most common is separation and stranger anxiety. Might be seen as excessive distress and impairment, or excessive crying and tantrums. For school-age children, there can be phobia, avoidance of objects or situations which they fear. Okay? There is a tendency to closely monitor the feared object. One patient of mine who had intense fear of COVID monitored all people coming in and out of the house. If the person took off his shoes, washed his hands, removed his outside clothes, etc. And this took up most of his day. Okay. The tendency to experience changes in somatic activity associated with avoidance and monitoring. And school age children may also manifest with physical symptoms like headache and vomiting. So the anxiety symptoms in younger children might be slightly different from older children. For adolescents, they might have obsessional thinking and compulsive acts. A lot of them report panic attacks, externalizing behaviors, intense worries about everything. Now, for depression, uh, red flags are the following, and these symptoms, at least five of them, must occur over at least 2 weeks for us to say that the child has clinical depression. For the mood, in children, there can be dysphoria or irritability or anger, but beneath that is actually depression. For their cognition, we can see anhedonia, feelings of worthlessness, inappropriate guilt, diminished ability to think or concentrate, suicidal thoughts and ideations. For the physical symptoms, weight changes can be seen, either loss of weight or weight increase, fatigue or loss of energy, psychomotor agitation or retardation. Okay? Other red flags for depression in children, they might complain of sadness or report a negative self-concept. Some kids who come to our clinics might say that, Doctora, isn't it normal to be depressed? Since they have been depressed for a long time, they think that it is the norm. Okay? Frequent somatic complaints are fatigue, stomach ache, or headache, social withdrawal. Most depressed kids will isolate themselves not just from friends but also from family. They will keep themselves locked in their rooms. And when in their rooms and away from families, what are they doing? They are on their gadgets and online. Okay? Their sleep are also disturbed. There is also increased sensitivity to perceived criticism or rejection, crying episodes, behavioral problems, anger outbursts, suicidal thoughts, and some have psychotic symptoms like auditory hallucinations. Okay, more red flags in adolescents naman. There is also irritability, anxiety, feelings of hopelessness, still isolation, sleep disturbance, lack of motivation, problems in appetite, either overeating or not eating, rebellious behavior can be seen, preoccupation with death and dying. Okay, now how do we advise our adolescent patients who are experiencing anxiety and depression? There are several mobile apps for mental health. They can access uh, apps for mindfulness and practice the exercises in these apps. Self-help interventions can be bibliotherapy or computerized therapy. These are all online. The effects are better if there is therapist input and involvement of parents. But I think this will be a problem if there is a relationship issue between the child and the parents. Some computerized cognitive behavioral therapy self-help programs are Mood Gym, Sparks, and Think, Feel, Do. Okay, others are practicing mindfulness, yoga, and simple exercises like walking around your block or engaging in a new activity. I have been hearing that a lot of people uh, engaged in baking in the US. Supplies of yeast ran out in groceries because a lot of people were baking sourdough bread. Okay, and here in the Philippines naman, I have been hearing a lot of people now calling themselves as plantita. Even me, I usually kill plants. I have engaged in growing plants. For the first time, my plants are thriving. So I also call myself plantita. Okay, some stress management techniques. Time management is important. Also, maintaining a daily routine. But this can be a challenge because we don't go out anymore. We don't go out to work or to study, but we do everything at home and in front of our laptop. So manage your workplace or your work table has to be clutter-free, and the environment has to be pleasant so that you may work at ease. Sleep adequately every night. This is important because even one night's loss of sleep will cause mood changes the following day. Keep things in perspective. Welcome change. Have a positive attitude to other people. Since we are all in the Philippines and we are all Filipinos, humor is important. Proper breathing is important, especially for those experiencing panic attacks. Progressive muscle relaxation, I always recommend this because when we experience stress and or are having a panic attack, we do not realize it, but we tense our muscles. So progressive muscle relaxation is purposely tensing and then relaxing the muscles. You can do this to different muscle groups like your shoulders, which is the most common part which you tense when you are stressed or busy with work. That's why when you finish your work, you wonder why your shoulders ache, why your back ache, why you crave for a massage. It is because you tense your muscles unknowingly. So practicing it, the purposeful contraction and relaxation of the muscles will help ease the back pain. Regular physical exercise is a big help. Even just walking around the block for 30 minutes at least every day is a big help. But don't forget, wear a mask. For coffee breaks, why don't you make it a little longer? And have a tea break. Now is the time to dust and use your fancy teacups and your fancy tea paraphernalia. Don't let them hide in your cupboards, but use them right now. Take a cat nap or power nap, even just for 30 minutes, but don't let it extend to several hours. Okay. Now, another authors published this article. He recommended tips for positive mental health during COVID-19. He recommended to have positive thinking, again, regular exercise, balanced diet. You know what? During the start of the pandemic, people were eating a lot of fast food because they would deliver to our houses, right? I'm also guilty of that. I was eating drive-through McDonald's and Jollibee almost every day because they were the only restaurants open. And then I put a stop to that diet. Okay? uh, Regular daily routine is important. Also, relaxation exercises and socialize online. Take a break from your routine work life, and other healthy life measures are important. Now, the big no-nos, the don'ts, substance use, okay? Because when we are all at home, it is very important to drink alcohol, to smoke a lot, okay? Eating too much fast food is also a no-no. Excessive online activity, excessive television watching, partying is definitely a no-no, and travel. Also, focusing on the negative aspects of the COVID-19 pandemic is discouraged. Posting about COVID-19 on social media is also not advised, especially spreading fake news and horror of horrors. If you believe fake news, that is a no-no. Okay. Another recommendation is effective regulation of emotion. What is this? This is the process of initiating, maintaining, and modifying one's emotional experience and expression. This is crucial to reduce the negative emotions and enhance well-being both within and outside work. Okay, so what are the strategies we can do for emotion regulation? Advice are seeking and reaching out to others to make them feel good. Okay, this helps regulate our emotion because when we seek out others, we get to know about their moods and problems, and we realize that it is not just us who are stressed, who are having anxiety or depression, but this is also happening in other people. And we might also even uh, think that we are luckier than others. Okay, keep yourself busy and work on other things. Engage in enjoyable activities to improve your mood. And for every stressful situation, always have a problem solving approach or attempt to solve a problem. So, emotion regulation actively takes control of your emotions, such as attending to one's feelings and actively seeking ways to improve them, will result in positive psychological outcomes. Regular and active appraisal of emotions or taking time to check in with oneself can help prevent individuals from being overwhelmed with stress and succumb to dysfunctional emotions. So, alleviating effects of regulation of emotions are the following. It reduces the negative emotions and enhances well-being. It enhances career adaptability and facilitates work-family balance. Now, if all else fails, how do our patients access help? Of course, it's the pediatrician who is the primary health care worker who the patient will go to first. So you are the frontliners in children and adolescents. So you should advise the parents that to talk about observed problems in their children. And then the pediatrician may refer the child to a mental health professional if he or she senses that the child has a mental health problem. If suicidal thought or attempt is present, it is important to refer to the nearest emergency room or hospital with a mental health professional. For those in the provinces, you may access the PPA website. It's in my slide for a list of psychiatrists in your area, and for the Philippine Society for Child and Adolescent Psychiatrists, our directory is still coming soon, but we are very small in numbers. We are only around 60 all over the Philippines. In the areas or regions with no child psychiatrist, uh, you can still refer to an adult psychiatrist because adult psychiatrists have training, although short, in child psychiatry. They have a rotation in child psychiatry. Thank you.
Thank you very much, Dr. Kaingog, for that very informative lecture. The current pandemic indeed has an impact in the mental health of both children and adolescents. And it's really good to have this type of lecture to better help our pediatricians, help their patients and their parents who have or are encountering mental health challenges or are in crisis during this pandemic. Now, one of the questions that we have that we'd like to ask our speaker would be one of the most challenging populations in our patients are basically the adolescents. And they often do not want to open up to their parents. And according to most parents, they would just often get irritable when we ask them how they are doing during the pandemic. How do we advise their parents on the approach to their adolescent children for them to be able to offer their support and just to check on how they are doing during this pandemic?
Okay, thank you for that question. This is really a frequently asked question, even among my patients. Parents usually ask, how do I get my teenager to talk to me? Okay, because it is commonly observed, no, that when the teenager and the parents are together, the teenager will clam up. They will keep quiet, right? And they will have this sullen look, di ba? So, good communication between parent and teenager is really cultivated. It is developed over time, and ve- it cannot be done overnight. But here are some suggestions. Just one. Actually, the way you communicate to your teen will depend on the teen's personality and the teen's communication style. But I'll just talk about one technique. Uh, first first is, do not ask the question in an interrogatory manner. For example, do not say, ano nangyayari sa Usually that's a common approach of parents, because if that is your approach, the child will be defensive. If you communicate with your adolescent uh, as if you were interrogating him or her, he will be defensive and clam up. So I suggest that you ask first about his interests, di ba? About what he's doing or he likes doing, his friends, ask about it. And then that's the time you segue to the issue that you want to ask. Or another approach is you ask the teenager's opinion about an event or something. For example, you talk about a relative or a neighbor, an event which happened to that person, and you ask the teenager about what he thinks. And then when the conversation is ongoing, that's the time that you segue to your issue. Okay.
Thank you very much, Dr. Kaingog, for imparting very practical ways on how to deal and talk to our adolescents. Now, in the interest of time, we can only ask one more question. And one of the issues of this pandemic is online schooling. And our children are having more time using now the internet and making use of their gadgets. And some of them, aside from school, would use it for recreation and for them to cope. Now, how do we limit this in our children, especially in our adolescents? And will it have a negative effect on them?
Okay. It is understandable that most kids right now will have to spend more time on their gadgets. So I think that the previous parameters as to screen time for children have to be loosened, because school is online, everything is online. So I will just recommend that parents still maintain control over gadget use. For example, how do you control? For example, put the study area in the teen's study table in a common area where adults can pass by or see what he is doing. So it's easier to monitor. Uh, I recommend also that at night time, for a lot of younger kids, you can ask them to surrender their gadgets. For example, at 9 p.m., when it's sleeping time, to surrender their gadgets. Because if you don't do that, they will end up staying awake the whole night. Or you can turn off the Wi-Fi at 12 midnight or 10 p.m. and turn it on again in the morning. That is to avoid sleepless nights in your teens. And another recommendation is to give them physical activities not involving screens, like let them help in the household chores, let them help with cooking, let them help with your garden, with your plants, etc. Of course, there are also other ways. Thank you.
Thank you very much, Dr. Kainghog. And I'm very sure our participants learned a lot from the session for today. So we'd like to turn over the floor to our MC.
Thank you very much to our speaker, Dr. Kainghu, and our moderator, Dr. Calleja, and to the Philippine Society for Child and Adolescent Psychiatry for this excellent and timely lecture. To end our meeting today and to give us the closing remarks, let us hear from the Vice President of the Philippine Pediatric Society, Dr. Florentina T.
Good day, everyone. Our mental health influences so much on how we go about our daily life. Today, the global COVID-19 pandemic has posed a greater challenge, and everyone are significantly at risk for mental health issues and concerns, particularly the most vulnerable population, the children and adolescents in our midst. We at Philippine Pediatric Society would like to thank our speaker for the extensive discussion on the topic, mental health of children and adolescents during COVID-19. While we all know that keeping the rest of our body in good shape is important, equally important is taking care of our mental health. The key points tackled by experts help us better understand how to help children and adolescents navigate their way out of the depth and to help them cultivate a positive and healthy mindset. To our dear PPS family, let us work together to take care of the mental health of the children and adolescents far and wide. Let us work together to safeguard the future of our nation. In behalf of the Board of Trustees, we again thank our speaker, Dr. Vanessa Kathleen Kainghog, Vice President, Philippine Society of Child and Adolescent Psychiatry, Dr. Mary Daryl Calleja, our moderator, Dr. Rodora Andrea Concepcion, President, Philippine Society of Child and Adolescent Psychiatry, to our Council Directors on Continuing Professional Development, Dr. Christine Gutierrez, Chairman Committee on Scientific Meeting, Dr. Florida Hernandez, Chairman Committee on CPD Online, Dr. Judith Garcia, Chairman on Child Health Informatic Committee. To our PPS Secretariat, June and Carl, thank you very much. To our Almighty Lord for the success of this activity. Health does not come from just medicine or pill. It comes from the gentle touch, a compassionate heart, and a loving kindness of people who truly care. With this, we thank you once again for joining and listening. Take care and keep safe.